Script title: Over 60? These blood pressure pills may be causing symptoms. You blame on aging script. Nearly 75% of Americans over the age of 60 take blood pressure medication every single day. But right now, thousands of them are sitting in doctors' offices complaining about extreme fatigue, brain fog, and aching joints, completely unaware that they aren't just getting old. Their daily pill is secretly causing it. In this video, we're going to break down exactly which blood pressure pills are causing these fake aging symptoms. By the end, you'll have a clear checklist of what's normal, what's definitely the pill, and exactly what to say to your doctor to fix it. But whatever you do, don't click away before we talk about the memory loss side effect, because there's one common pill that actively mimics early dementia, and you need to know if it's in your medicine cabinet. Welcome back to 30-Day Health. If you're new here, hit subscribe, because what you're about to hear is going to blow your mind. We have been conditioned to believe that the minute we cross 60, our bodies just naturally start falling apart. You wake up exhausted. You feel dizzy when you stand up to get the mail. You forget where you put your keys or lose your train of thought mid-sentence. You walk up a flight of stairs and your legs feel like they weigh 100 pounds each. We blame the calendar. We sigh. We make a joke about being over the hill, and we accept it. But what if the aging you are feeling right now is actually a chemical side effect? Why do the exact medications designed to keep your heart ticking actually make you feel like you are aging in dog years? And more importantly, how do you tell the difference between natural aging and a pill that is just a terrible fit for your specific body chemistry? To understand this, we have to look at the background of why these pills are prescribed in the first place and what happens to your body as you get older. High blood pressure, or hypertension, is a silent killer. It has zero symptoms. You can walk around feeling absolutely fantastic while your blood pressure is sitting at stroke-level numbers. The medications your doctor gives you are literal lifesavers. You need them. Nobody is saying you should stop taking your medication. But there is a massive disconnect between how these drugs are tested and how they actually work inside an older adult's body. When you are 40 or 50, your liver and kidneys are highly efficient chemical processing plants. You swallow a pill, it does its job, your liver breaks it down, your kidneys filter it out, and you pee out the waste. The assembly line moves at full speed. But as we cross 60, our organs naturally start to slow down. They still work fine, but they process drugs more slowly. Think of your bloodstream like a busy highway, and your liver and kidneys are the toll booths. At age 45, all the toll booths are open. Traffic flows right through. At age 65 or 70, a few of those toll booths close down. The traffic slows. The cars start backing up. When you take a medication every single day, and your body is clearing it out just a little bit more slowly than it used to, that drug starts building up in your bloodstream. A dose that was absolutely perfect for you at age 50 might be building up like a massive traffic jam at age 65. You are technically taking the exact same dose, but your body is experiencing an overdose. This leads directly into one of the most dangerous traps in modern medicine. It is called the prescribing cascade. This happens when you get a side effect from pill A. Instead of your doctor recognizing that pill A is the problem and changing it, they diagnose your new side effect as a brand new medical condition. Then, they give you pill B to treat the side effect of pill A. Let's say a blood pressure pill makes your ankles swell up. You go to the doctor. They do not stop the blood pressure pill. Instead, they give you a water pill to drain the fluid from your ankles. The water pill makes your potassium drop, which gives you terrible leg cramps. You go back to the doctor. They give you a muscle relaxer for the cramps. The muscle relaxer makes you dizzy and confused. You fall down and break your wrist. All because nobody looked at the very first pill and said, "Hey, maybe this just isn't the right one for you." But that's just the background. Wait until you see what the most common water pill is actually doing to your muscles. Before we get there, we need to break down the 4 main culprits sitting in medicine cabinets right now. Let's start with Section 1, the energy drainers. In the medical world, these are called beta blockers. You can usually spot them because their generic names almost always end in the letters olol, metoprolol, atenolol, propranolol, bisoprolol. Millions of people take these every day. Beta blockers work by blocking the effects of the hormone epinephrine. You probably know epinephrine by its everyday name, adrenaline. By blocking adrenaline, these pills force your heart to beat more slowly and with less force. This takes the physical strain off your heart muscle and brings your blood pressure down. From a purely mechanical standpoint, it is a brilliant way to protect a damaged or overworked heart. But think about what adrenaline actually does for a human being. Adrenaline is your get up and go. It is the chemical that gives you a burst of energy when you need to walk up a steep hill, chase after a grandchild, or just get out of bed on a cold morning. Taking a beta blocker is exactly like putting a speed governor on a golf cart. You can push the gas pedal all the way down to the floorboard, but the computer inside the cart simply refuses to let the engine go any faster. Your brain is telling your body to move, but your heart is chemically blocked from responding. Here is where it gets crazy. Because your body literally cannot respond to adrenaline, you feel completely unmotivated, sluggish, and heavy. You wake up after 8 hours of sleep feeling like you just ran a marathon. You drink 3 cups of coffee and you still feel like you are walking through wet cement. You sit in your recliner all day, skipping your daily walk, skipping your gardening, skipping dinner with friends. You think you have just lost your zest for life. You think depression is setting in. You look in the mirror and think, well, I guess this is just what getting old feels like. But it isn't. Your heart is literally being chemically commanded not to get excited. The fatigue isn't in your mind. It is a manufactured physical limitation. If you or your parents take one of these pills and this is suddenly making so much sense, hit that like button and subscribe. We're just getting started, and the next pill on the list is even more common. That brings us to section 2, the dehydrators. Doctors call these diuretics. Most people just call them water pills. You will see names like hydrochlorothiazide, chlorthalidone, or furosemide. These are often the very first line of defense doctors use when your blood pressure starts creeping up. High blood pressure often happens because there is simply too much fluid pumping through your blood vessels. Imagine your blood vessels are an overfilled water balloon. The rubber is stretched tight. The pressure inside is dangerously high. If you want to lower the pressure so the balloon doesn't pop, you have to let a little water out. That is exactly what a diuretic does. It forces your kidneys to flush sodium and water out of your body through your urine. The fluid volume in your veins drops, the pressure on your artery walls relaxes, and your blood pressure numbers look fantastic on the doctor's chart. But there is a massive catch. When you let the water out of the balloon, you also let out all the stuff floating around inside the water. Diuretics do not just flush out sodium. They relentlessly flush out vital electrolytes, and the biggest casualty is usually potassium. Potassium is the electrical messenger that tells your muscles to contract and relax smoothly. Without enough potassium, your muscles start misfiring. They lock up. They spasm. They feel incredibly weak. This causes a heartbreaking scenario for older adults. You start taking a water pill. A month later, your legs start cramping up in the middle of the night. Your calves burn when you walk to the mailbox. Your knees and hips feel stiff and heavy. What is the natural human reaction to this? You stop walking. You stop moving. You assume you have suddenly developed severe arthritis, or that your joints are just giving out because of your age. You might even go buy a cane or a walker. You go to a specialist and ask for joint injections. But your joints are perfectly fine. You just peed out all your potassium. You are experiencing severe, chronic muscle cramps disguised as aging joints. And if you think feeling tired is bad, wait until you hear the reason why some of these pills make you forget words mid-sentence. You won't believe how simple the fix is. First, we need to cover section 3, the fog and the cough. This group of medications is called ACE inhibitors. If you look at your pill bottle, these are the drugs that end in pril: lisinopril, enalapril, ramipril, benazepril. Lisinopril alone is one of the most prescribed medications on the face of the earth. ACE inhibitors work a bit differently. Instead of slowing the heart or draining fluid, they stop your body from producing a specific chemical that makes your blood vessels tighten up. By blocking this chemical, your blood vessels relax and open up wide. Think of it like widening a multi-lane highway. If you have 4 lanes of traffic crammed into 2 lanes, the pressure and congestion are terrible. If you open up all 4 lanes, traffic flows smoothly and the pressure drops. It is a highly effective way to treat hypertension and protect your kidneys from damage. But ACE inhibitors have a very strange, very specific side effect. While they are busy keeping your blood vessels relaxed, they accidentally cause the buildup of a totally different chemical in your body called bradykinin. And bradykinin loves to pool in your lungs and respiratory tract. When bradykinin builds up, it irritates the nerve endings in your throat and lungs. This causes a chronic, dry, hacking cough. It is a tickle in the back of your throat that you simply cannot clear. Millions of older adults develop this cough weeks or months after starting a drug like lisinopril. Because it happens on a delay, they never connect the cough to the pill. Instead, they think they have developed late-onset allergies. They think they have adult asthma. They worry they are developing chronic obstructive pulmonary disease, or COPD. They spend a small fortune on over-the-counter cough syrups, allergy pills, lozenges, and humidifiers. They stop going to movies or church because they are embarrassed by their constant hacking. They sleep in a recliner because lying flat makes the cough worse. They feel frail and sickly. They go to the doctor, and because of that prescribing cascade we talked about earlier, the doctor might prescribe an inhaler. Now they are taking an inhaler for a lung disease they do not actually have, all because their blood pressure pill is irritating their throat. The moment they switch to a different class of blood pressure drug, the bradykinin clears out, and the cough vanishes completely. We'll get to exactly how to talk to your doctor about this in a minute, but first we have to talk about the dizziness trap. This brings us to Section 4, calcium channel blockers. These are the medications that usually end in dapine. Amlodipine is the most famous one, along with nifedipine and felodipine. Calcium channel blockers prevent calcium from entering the muscle cells of your heart and blood vessels. Without that calcium, the blood vessels cannot squeeze tight. They are forced to stay wide open and relaxed. This is incredibly effective for lowering blood pressure, but it creates a mechanical problem in your body when you change positions. Think of your cardiovascular system like the plumbing in a 2-story house. When you are lying down in bed, your body is flat. Pumping blood to your brain is easy because it is on the same level as your heart. But when you stand up, your brain is suddenly 2 feet higher than your heart. Normally, your body handles this instantly. The moment you stand up, your blood vessels squeeze tight for a split second to shoot the blood straight up to your brain. It happens so fast you never even notice it. But if you are taking a calcium channel blocker, your blood vessels are chemically paralyzed in the relaxed, open position. When you stand up, they cannot squeeze. For a few agonizing seconds, gravity wins. The blood drops down to your legs, and your brain gets absolutely nothing. This causes a condition called orthostatic hypotension. It is a sudden, massive drop in blood pressure caused by standing up. You get out of bed, and the room starts spinning. Your vision goes black around the edges. You feel incredibly lightheaded and weak in the knees. You have to grab the edge of the dresser to keep from falling over. This is terrifying. The #1 cause of broken hips, shattered wrists, and traumatic head injuries in seniors is not being clumsy. It is not having bad balance or weak bones. It is standing up, having 0 blood flow to the brain for 3 seconds due to their medication, and fainting. Older adults start changing their entire lives to avoid this feeling. They shuffle their feet. They hold onto walls. They stop going out because they are terrified of falling in public. They look and act like they have aged 20 years in a single month, just because their blood pressure pill is working a little too well when they stand up. Let's look at how all these side effects play out in the real world. Consider the story of a 68-year-old man. We will call him Robert. Robert was a retired high school teacher, sharp as a tack, who did the crossword puzzle every single morning. He went in for a routine checkup, his blood pressure was a little high, and his doctor put him on a standard dose of a beta blocker to bring it down. 2 months later, Robert's family started noticing some terrifying changes. Robert would walk into the kitchen and completely forget why he was there. He would be in the middle of a story about his grandkids and suddenly lose the word he was looking for. He would stare blankly at the television. He stopped doing his crossword puzzles because he said his brain just felt too fuzzy. His wife panicked. Her father had died of Alzheimer's, and she recognized the signs. She thought Robert was slipping into early-onset dementia. They made an appointment with a neurologist. They were preparing themselves for the absolute worst-case scenario. Thankfully, the neurologist was a sharp geriatric specialist. Before ordering expensive brain scans, the doctor looked at Robert's medication list. He saw the beta blocker. He checked Robert's pulse, which was resting at a sluggish 50 beats per minute. The doctor explained that Robert didn't have dementia. His heart was beating so slowly and with so little force that his brain was simply not getting enough oxygen-rich blood to function properly. When your brain is starved of blood flow, it shuts down non-essential functions. Memory recall and sharp focus are the first things to go. The doctor cut Robert's beta blocker dose in half and added a mild, different type of medication to balance it out. Within 5 days, the brain fog completely vanished. Robert got his vocabulary back. He picked up his crossword puzzles again. His dementia was entirely chemically induced. If hearing this just gave you a massive sigh of relief, drop a comment below and let me know which symptom you've been dealing with. And make sure you're subscribed, because we're about to cover how to safely fix this. Let's look at another real-world scenario. A 62-year-old woman named Susan. Susan was a marathon walker. She walked 3 miles around her neighborhood every single morning without fail. Her doctor noticed her blood pressure creeping up and prescribed a standard water pill, hydrochlorothiazide. A few weeks later, Susan started feeling a deep, burning ache in her calves. Soon, her knees started feeling stiff. Within a month, she couldn't make it to the end of her street without her legs feeling like they were made of lead. Susan did what most people do. She went to a sporting goods store and spent $200 on new walking shoes with extra support. When that didn't work, she went to a podiatrist. The podiatrist gave her custom orthotics. When that didn't work, she just gave up. She told her friends, "I guess my knees are just shot. The walking finally caught up with me." 6 months later, she went for her annual blood work. Her doctor noticed her potassium levels were dangerously low. The water pill had flushed it all out. The doctor told her to start eating a banana every day and gave her a low-dose potassium supplement. Within a week, the burning in her calves disappeared. Her knees stopped aching. She put her regular shoes back on and walked 2 miles without a single problem. She had lost 6 months of her active life treating a joint problem that never actually existed. The craziest part is still coming, because there's one side effect people spend thousands of dollars trying to cure when all they needed was a different prescription. We see this all the time with men and women who start taking ACE inhibitors and develop that chronic cough. They go to an allergist. They get skin prick tests. They buy expensive HEPA air purifiers for their homes. They rip up the carpet in their bedrooms thinking it is dust mites. They spend thousands of dollars trying to sanitize their environment to stop the hacking cough. All they needed to do was ask their doctor to switch them from an ACE inhibitor to an ARB. An ARB is a cousin to the ACE inhibitor. It lowers blood pressure the exact same way, by relaxing the blood vessels, but it does not cause the bradykinin buildup in the lungs. You literally just switch the pill, and the cough goes away forever. 0 air purifiers required. So what is the big reveal here? What is the takeaway you need to understand right now? You do not have to accept feeling terrible as a mandatory tax for getting older. Blood pressure medication is not a one-size-fits-all situation. There are dozens of different classes of these drugs. There are beta blockers, ACE inhibitors, ARBs, calcium channel blockers, diuretics, alpha blockers, and central agonists. Within each of those classes, there are 5 or 10 different specific drugs. If one pill makes you feel 90 years old, your doctor can easily switch you to another class that keeps your heart safe and gives you your life back. But doctors are busy. The average appointment lasts about 15 minutes. If you walk in and say, "I'm tired and my joints hurt," the doctor is probably going to look at your age, nod sympathetically, and tell you to get more rest. They are not going to instantly connect the dots to the prescription they wrote a year ago. You have to be your own detective. You have to be your own advocate. If this video is helping you take your health back, hit subscribe to join the community. All right, let's get into exactly what you need to tell your doctor tomorrow morning. Here is your step-by-step checklist for how to handle this. Step 1 is the pill audit. Go to your medicine cabinet right now. Pull out every single prescription bottle you have. Look at the generic name of the drug. Look for the suffixes we talked about today. Does it end in olol? Does it end in pril? Does it end in dipine? Is it a diuretic? Write down exactly what you are taking. Step 2 is the symptom timeline. Get a piece of paper and write down exactly when you started feeling these aging symptoms. Did the brain fog start a few weeks after they upped your dose? Did the leg cramps start the same month you went on the water pill? Did the dizziness start when you changed medications? Doctors love timelines. It gives them hard data to work with. Step 3 is the conversation. When you go into the doctor's office, you have to use specific language. Do not just complain about getting old. You need to say the magic phrase. Say this exactly. I am experiencing unacceptable side effects that I believe are tied to my blood pressure medication. I want to do a medication review and try a different class of drug. Notice the word unacceptable. That is a powerful word in a medical setting. It tells the doctor that you are not just venting about minor discomfort. It tells them this medication is ruining your quality of life, and you demand a solution. Step 4 is the follow-up plan. Ask your doctor. If we switch this medication today, how long should it take for these side effects to clear out of my system? Get a timeline. If they say the dizziness should stop in a week and it doesn't, you know you need to go back. You also need to ask about drug interactions. Sometimes the blood pressure pill is totally fine on its own, but it is picking a fight with your arthritis medication or your cholesterol pill. The liver can only process so much at once. If it is busy breaking down a painkiller, the blood pressure pill backs up in the system. It is also critical to understand that you should never, ever stop taking your blood pressure medication cold turkey on your own. Rebound hypertension is a very real, very dangerous thing. If you suddenly stop taking a beta blocker, your heart can get flooded with adrenaline all at once, leading to a massive spike in blood pressure or even a heart attack. You must do this with your doctor's supervision. They will taper you off the old drug while slowly introducing the new one. The next time you wake up feeling exhausted, achy, or foggy, do not just stare at the ceiling and accept defeat. Look at the pill bottle on your nightstand before you blame the calendar. Aging is a privilege. Getting older is something we should all be lucky enough to experience. But feeling old, feeling frail, feeling foggy and weak, that does not have to be a reality. Your body is an incredibly resilient machine. Sometimes it just needs the right fuel, and it needs the wrong chemicals out of the way. Take your timeline, take your pill bottles, talk to your doctor, ask for that medication review, and take your energy back. You have so much life left to live, and you deserve to actually be awake for it.